For nearly 30 years, Humana has offered Medicare plans to the public. In that time, we've learned a lot about how to be a better partner in health. Our goal is to help our members achieve lifelong well-being. At Humana, we know thinking about Medicare and all your options can be overwhelming. We want to help you understand these options and the plan that you choose. We'll start by looking at when you can enroll. There are specific times when you can enroll, disenroll, or change your Medicare plan. October 15th until December 7th is the annual election period. During the rest of the year, you may qualify for a special election period or SEP if certain special circumstances apply to you. If you've missed regular enrollment, you can speak to your agent about whether you qualify for SEP. Now it's time to address your Medicare options. Option 1 is Original Medicare. Original Medicare doesn't cover prescription drugs. This means you may need to enroll in a separate Medicare Part D prescription drug plan, often called a standalone PDP. Option 2 is Original Medicare plus a Medicare supplement policy plus a prescription drug plan. Many people who select Original Medicare purchase a Medicare supplement plan, also known as a Medigap policy. They do this to reduce their financial liability. If they need drug coverage, they may also add a PDP. Option 3 is Medicare Advantage. You can choose to get your Medicare coverage through Medicare Advantage. These are often called MA plans. With many Medicare Advantage plans, you'll have a health plan and drug coverage, and you won't need a Medicare supplement plan. One plan, one company. Simple. Let's go into some more detail about Option 3, Medicare Advantage. The federal government Centers for Medicare and Medicaid Services, CMS, refer to Medicare Advantage plans as Medicare Part C. Private insurance companies approved by Medicare provide this coverage. Medicare Advantage plans offer all the benefits of Original Medicare, but most have lower out-of-pocket costs. MAPD plans are Medicare Advantage plans that also include Part D prescription drug coverage. Many Medicare Advantage plans offer extra benefits as well. Keep in mind, Medicare Advantage plans are not Medicare supplement plans. Medicare supplement plans are purchased in addition to Original Medicare. They offer all the benefits of Original Medicare and more in one simple package. When you enroll in a Medicare Advantage plan, you still have Medicare. You don't lose it. You're just choosing the Medicare Advantage version, which is administered by a private company rather than the federal government. Now you know your options, but how do you select the plan that's best for you? Start by asking a few simple questions to decide what you'll need from your Medicare plan. What type of plan do you currently have? What do you like about your coverage? What would you add to your current coverage to make it ideal for you? Does anyone help you make decisions about your health care, and should they be present? Once you've answered these questions, you'll be ready to start looking at available plans. So you choose a PPO plan. Let's look at how that plan works. In general, with a PPO plan, you have a defined network of doctors, specialists, hospitals, and other medical service providers. You will not need a referral to see any doctor. You also have the flexibility to see providers who are not part of the network. But your out-of-pocket costs may be higher when they're used, except for emergency or urgent care situations. The advantage to staying within your PPO plan's network is that your out-of-pocket costs may be significantly lower because the plan pays a larger share of the cost. Do you need prescription drug coverage? Here are a few things to keep in mind. If a PPO plan does not cover prescription drugs, CMS does not allow you to combine a prescription drug plan with it. Ask your sales agent to review a plan's prescription drug coverage with you. For a plan with prescription drug coverage, be sure to review the formulary or drug list with your agent. This is a list of specific medicines covered by the plan and is available at Humana.com. Even if you see your medicines listed, in some cases Humana may require you to try certain drugs first to treat your condition before it will cover a more expensive drug. This is called step therapy. The Medicare prescription drug coverage gap, or donut hole, is the period when you pay part of your drug costs before additional Medicare coverage kicks in. This year, once you enter the coverage gap, you'll receive discounts on your prescription drugs. You'll be responsible for paying no more than 58% of the cost of many generics and no more than 45% of the cost of many brand-name drugs. Manufacturers must agree with CMS's terms and conditions to contract with Medicare, so not all brand-name drugs may be covered. If you're covered by both Medicare and Medicaid, you may be eligible for another type of Medicare Advantage plan with prescription drug coverage. Contact your state Medicaid agency and your doctor to determine if a special needs plan is a good option for you. For extra peace of mind, it's good to note that Humana Choice PPO plan is reviewed and approved annually by CMS. Okay, now that we've discussed when to sign up, what your Medicare options are, the specifics of a PPO plan, and prescription drug coverage, what's next? First, your agent will review two very important documents: the Summary of Benefits, which covers many of the specific features of the Humana Choice PPO health plan, and the formulary or list of drugs covered by this plan. Then, if you choose to sign up and become a Humana member, you'll decide if you'd like to receive your plan coverage documents online or paper copies in the mail. Online is a great way to stay organized and save paper. If you choose our online option, we'll send you an email. You can then go to myhumana.com anytime and get started, learn more about your plan, and view your plan documents. You'll receive your Humana member ID card in the mail. You'll complete a health assessment by phone or online if you've chosen our online option. This health questionnaire is utilized to see if you qualify for any special health programs. We also encourage you to attend a member orientation, which will help you use your plan and extra services to their full advantage. We've covered a lot of information today, and if you still want to know more, don't hesitate to call us. We're your partner in health and happy to speak with you anytime you have questions. Your Humana licensed sales agent, who's presented your specific plan benefits today, will also be happy to answer any additional questions. Another great resource is the Medicare and You Handbook you should have received in the mail. You can also go to www.medicare.gov, the official Medicare website.